Hello everyone, this is Salam and today I'm going to explain you syncope due to orthostatic hypotension. And by the end of this video, I will also explain or compare the difference between vasovagal syncope and syncope related to orthostatic hypotension. So what's syncope by the way? Syncope is a transient loss of consciousness usually associated with hypoperfusion to the brain. To begin with orthostatic hypotension, let's consider a patient. So a patient taking a standing position from bed and taking 2 steps, then collapse. We call this orthostatic hypotension related collapse. To diagnose this, first the systolic blood pressure must drop by at least 20 or the diastolic blood pressure must drop by at least 10 within 3 minutes of the standing position. If you already come to this point, then the next step, you need to measure the heartbeat. By using your stethoscope, you measure the heartbeat of the patient, and if it is greater than 20, it suggests you the hypovolemia or dehydration. If the heartbeat is not changing, that suggests your autonomic dysfunction. Let's talk about the pathophysiology of orthostatic hypotension. So, when a person takes a standing position, the gravity starts to pull up to 1 liter of blood to the lower extremity and to the splanchnic circulation. So this reduces the preload, the amount of blood which comes back to the heart, and this is the cause that the cardiac output will be minimized and the blood pressure goes low, so the hypotension occurs. So for this hypotension, normal individual and a patient with orthostatic hypotension react differently. So the baroreceptors, which are usually found around the carotid sinus and the aortic arch, these receptors fire when the blood pressure goes low. So when these receptors fire, the sympathetic nervous system is activated, and the activation of sympathetic nervous system leads to vasoconstriction and increased blood pressure as well as increased heart rate. However, a patient with orthostatic hypotension will not do the same. The compensation mechanism fails. This leads to the reduced amount of blood flow to the brain. When the blood flow is minimized to the brain, cerebral hypotension directly leads to syncope, and you immediately find a patient lying on the ground. So what are the causes of orthostatic hypotension? Generally, there are 3 major causes of orthostatic hypotension. The first and the most common cause of orthostatic hypotension is medication induced. Some medications, usually the vasodilators, including alpha-1 blockers, beta-2 agonists, and tricyclic antidepressants, are involved in syncope related to orthostatic hypotension. The next cause is the neurogenic. Some patients with DM and Parkinson's disease have neural damage. So this neural damage leads to failure of compensation. The third cause is hypovolemia. It can be due to hemorrhage or dehydration. Finally, let's compare the vasovagal syncope and syncope associated to orthostatic hypotension. So, vasovagal syncope occurs when a person takes a standing position for prolonged time. However, on the other side, the orthostatic hypotension occurs within 3 minutes. Another difference is that vasovagal syncope has warning before syncope, like sweating and nausea. But orthostatic hypotension do not warn. You immediately find the patient falling on the ground. That is the difference between vasovagal syncope and orthostatic hypotension. I hope this video is helpful, and if you find it helpful, please subscribe to my channel. Now the diagnosis, heal the patient and join me on the healing path. See you on the next video.